Welcome to the Oxygen Alliance YouTube channel, where we bring you videos on installation, maintenance, and various trainings on oxygen equipment and devices. If you have comments and or questions, drop them in the comment section below or write to us info@oxygenalliance.org. Remember to like our videos, subscribe to our channel, and hit the notification bell.
Hello everyone, welcome and thank you for today's webinar brought to you by the Oxygen Alliance. My name is Ephraim Mandala, a biomedical engineer working with the Oxygen Alliance, and I'm delighted to be your host today. I'm joining this call from Lilongwe, Malawi, and I would like to know where you're joining us from by typing your name and location in the chat. Also, if you want to be added in the emailing list and get notification of upcoming events, please type your email in the chat as well. Today, we have a very exciting topic on management and technical repairs of dental units, which will be presented by Engineer Joseph Wananda, an experienced biomedical engineer from Kenya. So, audience, if you have any questions and comments along the way, please just note down, as I'll be taking all comments and questions at the end of the presentation. So, without wasting much of your time, let me hand over the floor to the audience, to the presenter. Over to you, Engineer Joseph.
Thank you. Thank you, Engineer. Hello, everyone. Good afternoon, good evening, depending on where you are. It's my pleasure to be your presenter today. My name is Engineer Joseph Wananda, based in Kenya, Nairobi. So today, we'll be talking about dental management and technical repairs of a dental unit. So without wasting time, our course outline today will be introduction of the dental unit, understanding its life cycle, preventive and corrective maintenance, calibration performance, infection control, and risk management. So what is a dental unit? Dental unit is a machine mostly used by the dentist or maxillofacial surgeons in dental procedures. So the dental unit comprises of two items, that is dental chair and delivery, forming a dental unit. So the dental unit must be able to provide a comfortability in terms of the workspace, comfort of the patient and the doctor or the user. It's also supposed to help the patient achieve the medication. So this is the standard dental unit. Dental unit comprises of dental chair, this part here is the dental chair. You have the backrest and the headrest. The backrest and the headrest comprises of upholstery. Upholstery is the couch, and it's designed ergonomically in comfort of the spine of the patient. In addition to that, we have a dental light here. It enables the doctor or the surgeon or the dentist to visualize the area of the procedure. So we have several types of light. With this LED one, we have halogen one, and more. From this point here, we have what we call the delivery. The delivery comprises of 5 cordon cables moving from the left. We have the 3-way syringe. 3-way in a manner that it can project water, pressurized water, air, or if you activate both, it comes a spray. That's the derivation of the 3-way syringe name. So in the middle, we have the hand pieces cordon. You have 2 high-speed handpieces and 1 slow-speed handpieces. And the far end, we have the scalar handpiece. We also have a control here. This is a control panel. This enable or deactivate the movement of various functionality of the dental unit. It can also activate some function of the lights and more. At the far end here, we have what we call the X-ray viewer. This is where, upon taking the film, the X-ray, the dentist uses to view the images. If you come down here, we have what we called foot pedal. Ordinarily, foot pedal is supposed to activate the functionality of the handpieces, the turbines here. But in some cases, it also have a control switch. So it functions like a control panel here. The same function done by the control panel can be done with the foot pedal here. That means it can operate the movement, it can activate water, it can lock water, it can activate air, it can activate light, and so forth. This one, at this point here, we call it a stool. So a stool, this is where the dentist sits during the procedure. And normally there are 2, one is for assistant on the other side, this one for the dentist. Then we have the assistant or assistant delivery, this one. Assistant delivery, it harbors high suction nozzle. It's supposed to be connected with the central vacuum system. Then we have low suction nozzles, which is internal suction from the Venturi principle inside the chair. And then here, at the same point here, we have 3-way syringe, like the delivery point. And it's where we also have the light cure. Here we have what we call P2 or Caspido bowl. This is where the patient spits whatever in his or her mouth towards the drainage system. Beside here, we have what we call it tumbler filler. Tumbler filler is where you fill the clean water for gargling. These are just the normal armrest, this one, for comfortability of the patient. So our case here is hydroelectrical. Let's go on. These are what I've just talked about. Yeah, whatever the details on what the dental chair comprises of. See the 5 cordon and everything. So I'm not going to repeat this one unless there's a question on the same. The 5 cordons is from the 3-way syringe to handpieces to scalar. The cords that have been attached with the delivery system. Similar here, X-ray viewer, foot pedal, the ceramic bowl, everything as mentioned already here. The cushion is what I've said, the upholstery where the patient sits on. And then you have the doctor's stool with 3 adjustable positions. So it can move up and down, it can also lean backward for the comfortability of the spine of the user. So this is basically the internal delivery system. This is how it looks like. Here we have pressure block, this one. This is the pressure block. This is where now upon the activation of the foot pedal, the air comes in here to communicate with the valve, the lock valve here. If you activate this valve, it will communicate with the air block to activate the turbine air. The turbine air will come from this block and come through this handpiece. That means the rest of the handpieces will be locked, will not be operational. And this is a water block. So this is a simple delivery internals, how the tubings run. From this point, there's a small knob here. This we call it a control. a movement control airlock. So this one, if you activate it, you can be able to position your delivery in the position of your choice. You can activate it and then pull it up, and if you leave it there, it locks there. So actually, it's a very important part in terms of the movement. So we go on. There's a black thing here. This black thing is very important because it's the pressure gauge. This is where you can be able to monitor the operational pressures. At some point, there's a sight glass beside here, so you can be able to see what the pressures are you using to drive the turbines. So this is gauge, just a gauge, a normal gauge. So this is now the ordinary delivery. As I said, we have two types of delivery. This is the hanging type. This is the top-mounted type. It depends with the preference of the user, what they prefer to use. At the same time, you have two types of the Caspido bowl or the spittoon. This is ceramic and the other one is glass. So the user decides on what they want to use of the two, and their maintenance is also different. So up to this point, we have now the turbine itself. We call it handpiece. So whatever we have here is a high-speed handpiece. It's a 4-hole high-speed handpiece. So at this point is where we have the cartridge here. It's where we have the cartridge. And the cartridge, we have insert from the cartridge upon pressing of the end cap. The cartridge will open and then insert your bar and then you release, the bar will hold into place. So the moment you realize this position or this cartridge is not holding the bar, you know the cartridge is faulty. It's a very dangerous thing, so you need to change the cartridge. So this is the layout of the cartridge. It's broken down into pieces. This is where we have the bearings, with small balls bearings, both interior and posterior. So once the air enters in the holes, yeah, we have the big holes. The 4-hole handpiece have the big holes too, and they have 2 small holes. So in those big holes, we have smaller of the bigger 2. That is the entry point of the air. So the air will land in the turbine blades here and rotates and come via the other bigger hole. So the complete rotation will create a high revolution in this turbine. And remember, the turbine is holding a bar on it. As a result, this is where the bar goes in. As a result of that, a high revolution is created, and the dentist is using that revolution to do the drilling and polishing of the teeth. So we have a general overview here. So patient positioning, dental chair, patient positioning with electronic control include headrest, footrest, tilt, and recline features. So we can, as I said before, we can use the foot pedal to do the positioning of the patient. It can goes up, can goes down, can goes backrest, can go uprest. Then we have the delivery system. So the delivery system is where we hold our handpieces with the 5 cordon. We have the handpieces, we have the 3-way syringe, we have the control panel, we have the X-ray viewer, we have the gauge, yeah, and we have the scaler. Then we have the suction system. Suction system is on the assistant part. We call it assistant delivery part. So this is where we have the internal suction system, which we call it low volume suction system, using the internal venturi system, where the venturi block is activated by the pressures, external pressure, to create a low pressure zone that creates the vacuum. And then we have a high vacuum system, which is supposed to be linked with the central vacuum system. Then we have a compressor unit. Compressor unit is where our pneumatic compressed air coming from. Should be oil-free, silent, and clean. Then we have vacuum system. As I said, we have central vacuum system We have internal vacuum system. Then we have water line. Water line, normally we have a provision of the bottle inside the unit where we can fill in a clean water. Remember, this water goes directly to patient mouth. It's very important in infection control. So the water should be clean, less acidic for the purpose of the maintenance of the tubings and the cartridge, and also the safety of the patient. And then we call it industrial or city council water. This water normally is connected directly to the Caspido bowl or the spittoon bowl. It's normally used for rinsing. That is where it ends. It doesn't go beyond that. Then we have control panel. The control panel is where we do our control mechanism. We can activate our lights, our movement, and so forth. So how does the machine operate? The machine can be electromechanical in a way that it operates both with electrical and pneumatic system. Once you feed in your air from the compressor point, you feed in your water from the internal bottle, clean water, and then you feed in your power. The dental unit will be able to move up and down and position of your choice. The light for visualization will be able to come on. The pneumatic system, that is water, vacuum, and air, will be running the turbines and doing the cooling and rinsing purpose. So on the suction side, as I said, we have central vacuum system, which are interlinked with the units with activation switch. Upon activating of the valve, sorry, the vacuum comes automatically. It doesn't have to go and move and switch it on. There's a way you put a micro switch or a pressure switch. So if you lift the valve on a high vacuum suction nozzle, it comes on automatically. Otherwise, you can use internal suction, which only require a provision of compressor with a constant flow of pressures. The internal vacuum system will work perfectly. Then we have electronic circuit. This enables the control of lights, movement, scalers, light keyword, and so forth. We have touch screen, button control. These are just the activation keys that you use to activate this movement. Then we have handpiece. We have interlocks. Handpiece stops spinning when you return the cradle. Yeah. What happens that we have activation valve. We call it lock valve, where the handpiece rests. So when you activate the foot pedal, the pressure is the foot pedal, without lifting up the handpiece on the cradle, the turbine will never run because the lock valve or air lock valve still isolating the flow of pressure to the turbine. So you have to lift it up and then activate the foot pedal. That is the only moment that the turbine will be able to run. So, life cycle of a dental unit. All the equipment in the dental practice, from the single-use zero-inch diagnostic imaging machine, has a life cycle. So every stage should be proactive with the following component: need assessment, quality and durability, future-proven ergonomic, tracking and maintenance of the dental unit. So this comes in a stage where you procure. How do you do it? As engineers, we are invited with a dental practitioner or a maxillofacial surgeons. They want to set up a dental setup. You are supposed to have a plan. This plan, you should be able to define the flow of the effluent, the drainage system. You need to design in a way that the drainage system have enough gradient. Remember, the effluent from the dental mouth of the patient, they are very thick because they comprise of blood, sputum, and so forth. So there must be a very effective drainage system with an odor mechanism. We call it, if you go detail into plumbing work, you'll be able to know how to design that. Now, from designing, you need to also have a pure or a safe power point, a power that doesn't have leakage current, doesn't have a lot of short circuiting, need to be stable. And then you need to have a compressor design, where your compressor will be. If it is industrial compressor, which make a lot of noise, you need to put it far and do the pipe work. If it's a silent one, oil-free, you can design it near the clinic. Use the time of the planning. And then you do the procurement. The procurement is very important because it will determine the durability of your machine and the quality. From there, you need to emphasize on the maintenance. So once you put more emphasis on the maintenance, definitely your machine will live longer. Otherwise, you will have a very short time disposal. Yeah, downtime. Machine will just break down in a few times. So those are very important factors to consider when you are identifying the life cycle of a dental unit. This is what I've talked about, the technical evaluation, user input, compatibility with facility, utilities. Those are kind of water, everything that we've talked about. Then they must meet ISO standards. You don't just go for a dental unit for purpose of going for a dental unit, must meet a dental standard. Then you check your power, your input, your vacuum, your water, the water line, the quality of the water going inside the unit, whether they're acidic, hard water, soft water, clean. Those are things you need to put into consideration. Yeah, I've mentioned all those. Operator dependent performance will depend on the technical know-how of the user. So once as engineer, you've done your installation, you need to provide technical know-how for the user so that the machine should be able to operate optimally. In terms of maintenance, we start by compressor. You need to frequently drain compressors. Remember the compressor, once you keep air inside them for long, they condense back to water. The water inside the compressor lining will react with the compressor lining, forming a sort of a weak acid. This weak acid will be propagated via the line, the water line, to the tubings, the silicone tubings. These silicone tubings will change in their chemical compound, so they will become very brittle in a very short period of time. Compressors, they break very fast because of mismanagement of the compressor, or rather the quality of the water you are using. At what point are you supposed to decommission the machine? Once the machine is unsafe for the use, or any part is unsafe for the patient and the user, that machine need to be considered an operational. You need to decommission that machine. So if I said water line, we need to you need to put filtration. I said this water line is very important in terms of the tubing durability. So once your waters are not clean, or compressors of weak acidic, then you can be for sure replace your tubing in a very short period of time. In terms of the suction, the effluent, you need to clean the filters and remove the clog from the alginate composite that are coming from the patient almost daily, depending on the procedure. So this is supposed to be done daily. Yeah, the suction need to be disinfected. We have various types of disinfectant used in disinfecting the suction line. I have given an example here, the Orotol Plus, and many more. So handpiece. The handpiece, remember the handpiece is very important in the dental unit because it helps in terms of the drilling and the polishing of the teeth. So once you don't take care of the handpiece, the turbine or the cartridge will go down. The cartridge will go down, I tell you, in a very short period of time. What causes the cartridge failure? Once I've mentioned the unregulated pressure, high pressures causing a lot of the heat generation inside the turbines, the absence of water for cooling, lack of maintenance. Remember, after drilling, there's some part of the teeth are clogging in the cartridge and the handpiece at whole. So what do you need to do? You need to make sure that the turbine is clean. There is a procedure on how you clean the handpiece. Once, I will go into details once we get another chance, or if you have any question, I will explain that. But the handpiece needs to be clean and sterilized after every single operation to remove the clogging particles and creating cross-infection from one patient to the other. So the chair mechanics, most of the modern units, they're using the telescopic motor to create the mechanical movement. This motor, they are very simple to maintain. You just need to keep them free of the dust. And also, you lubricate with a clear, call it a clear oil. But that's one you do only when you hear mechanical noise. Otherwise, they are very effective and doesn't require to be tampered with. Most of the time, the noise is being caused by misalignment. You realize the unit is not fully aligned or not lying in a plane surface. So you need also to make sure that your surface is plane by using spirit level so that all the weight can be transmitted uniformly to the ground. So what do we check? You can check your tubings for the leaking. You can do leak tests. You can check your pressure gauges if are normal by visualizing on the operation pressures. Remember, we have an operation pressure gauge in the delivery point. So the input pressure to the turbine is supposed to be 4 bar. Something above that actually is killing the turbine by creating unnecessary heat. So the compressor pressures coming in should be from 6 to 8, and then you regulate it at the delivery point. So check the pressures, check the leak flow, check the leakage current from your control, do the functional test of the motor, the noise. I've told you the reason why the units make a lot of noise. Normally people rush to the motors and the telescopic, but it's only the surface. The flow is not uniform. So common breakdown. If you realize there is no suction, this is the Venturi suction. Just know there is a blockage somewhere. This blockage comes from the filters. Once you suck things from the nozzle point, it goes to a certain filter before it goes to the line. So this filter needs to be clean after every procedure. So once the alginate composite and particle from the calcium teeth breakages fill this space, the suction will not have power. So you need to clean these filters, clean the nozzle, check the blockage of the nozzle. So water not flowing, most likely you should check the solenoid valve or the water block. Normally comes from the airlock. So you need to bleed the system and replace the valve if necessary. So handpiece not spinning. Normally it's a one turbine, or we call it cartridge. Cartridge, if cartridge is one, it's stuck. And this is caused by by lack of cleaning of the cartridge point. That's why I've said that after procedure, you need to clean it. So you need to replace the turbine, or you check your pressures in the compressor. Perhaps the input pressures is not sufficient to run the turbine. So chair stack normally comes from the control board fault or actuator jam. So you need to reset breaker, test actuator for continuity. Compressor not starting. This comes from the fault of the compressor. You need to check the thermal overload. Normally the compressor runs for a very long time, so they refuse, they jam to start until they cool down. So either you need to reset, or you need to check if the pump is okay and change any faulty switch from the compressor point. Corrective maintenance strategy. You need to fault logging. You should be able to have a list on timely or whatever is reported that is commonly creating problem. So you need to have a list. So once you go for corrective maintenance, you should have your checklist. If you need to isolate of subsystem, for example, suction, air, chair, you need to isolate all this and do a thorough clean. You can purge the airline, you can clean the suction, disinfect the suction, remove the clog. You can also do the visual inspection. For example, if there's anything carbonated from the electrical board, or you can do testing by your multimeter and do part replacement once you realize there's something faulty. So post-repair verification and documentation is very important. You need to document your technical report so that you know, you get the trend on what is commonly breaking down. This can help you come up with the possible or permanent solution. Probably it's only the input power is not clean. So the power is not clean. So you need to know why always my step-down motors always blowing off. You don't have to replace motor, replace motor, replace motor. You need to find out from your record. So spare part you need to keep is a handpiece turbine, so the cartridges. These are the common things that usually get faults. However, once you maintain your operations or your handpiece maintenance, you can for sure utilize your handpiece for a very long time before you replace the turbine, the O-ring. Make sure you have solenoid valve, the fuses in place. The hoses for the nozzles, for the suction nozzles, they decolorize because we do disinfection every time. So we need to replace them. The tubing, the handpiece tubing. Make sure to have a spare part inventory so that you know what kind of spares are being utilized most frequently. So these are just basically common spare part. We have the control. We have here, this is the control, movement control. We have here step-down transformer. And these are the key, the control keys and the board. These are the board, control board, activation keys or touchpad. This one. And these are the nozzle. This nozzle need to be replaced every time. Yeah? So what do you need in terms of calibration? You need a pressure gauge. Pressure gauge, this one will enable you to know the input pressures. So this pressure gauge can be able to test from the pressure from the compressor point and also test in the unit point, whether there is somewhere leaking or if there's a blockage somewhere. So you need this item with you always. You need meter. You need tachometer to test the pressures of the handpiece, the revolution per minute. The PowerPoint is not shared. Somebody is requesting to share the PowerPoint.
All right, so Engineer Joseph,
Yes.
We'll share the presentation. We have an app, which is a PME Concert app. So every resources from Oxygen Alliance is shared through that app.
Okay. Okay.
Sure.
That's okay. So what do we calibrate? We have a zero reference. Zero reference, you achieve it by resetting the unit into its zero position. There is a reset button and set button. So you can really calibrate the positioning of the chairs through the control panel. You will see the set and reset. We can calibrate water. Yeah, as I said in the tumbler filler, it's a way you can activate the level of the water filling in the tumbler. So a single press of the control panel will give exact measurement of the water the patient needs to gargle. We can calibrate as well the handpiece revolution per minute by the handpiece control gauge. Beneath the delivery, there are 3 silver control knobs that you're supposed to use to regulate the pressure that goes to the handpiece. So all this equipment need to be compliant with whatever the ISO safety indicated below. Electrical safety for the purpose of the safety of the patient and the component, also the hygiene and the manufacturer's specific performance benchmark. So these are the infection control. We have, remember when we are doing procedures, we are operating in different patients. You don't know what patients are ailing from. So we have a lot of medium of which the infection can be transmitted from one place to the other. So therefore, we need to take care of the handpieces. Anything that goes in patient mouth need to be sterilized. They need to be swabbed with the correct the sterilization fluid. Yeah, the proper sterilization need to be done. We have typical autoclave for dental instrument. We call it tabletop. It does sterilization to the drying. So we don't just put the instrument, the dental instrument, in the industrial or central sterilization unit. We have mechanism of which we sterilize dental equipment for the purpose of the durability. So control measures, anti-retraction valve to stop suck back, disinfection logs and validation reports, biomedical engineer to ensure staff follow all protocols. So these protocols are very important in terms of even cleaning of the filters. Some users doesn't like touching these filters because they know it carry a lot of infection. So they leave it like that. And then the things clog down, then they will call you to come and do the maintenance. But you should make sure that they follow the protocols on how to follow the procedure and clean the filters and everything. So you need to, for risk and safety consideration, you need to check electrical leaking current, earth resistant, the equipment must be fully earthed, plug sockets must be free from leaking or short circuiting, pneumatic monitor air, water pressures, these are very important for the turbine movement. So once these pressures are not right, or they are low or too high, if they are low, the turbine will not run. If they are too high, remember they are interfering with the durability or the functionality of the turbines. Then relief valve testing. Ergonomic, ensure preset, reduce musculoskeletal. This ergonomics comes from the upholstery where the patient sits and where the doctor sits, the patient stool and the patient backrest, very important for the spine. So I think the presentation comes to an end. I think right now I'll invite some questions. If you have some questions, you are free. The floor is yours. Thank you.
All right, so thank you, Engineer Joseph, for such a wonderful presentation. Now, audience, the floor is open for comments and questions. Please feel free to raise your hand or type your question in the chat. I will grant you an opportunity to ask. Thank you. All right, so I see a hand from Jakuma. And you ask yourself and ask. Thank you so much for your presentation. But I have a question about, I've encountered some dental chair and you find the backrest from nowhere just goes back without any command being pressed. How could that be solved and what's causing it? You try, as you're operating, you just find that backrest just slowly by slowly goes down. The chair is made up of motors. The motion uses motors. How do I solve that problem? I tried to take the board was okay. I was like, hey, what's happening? Please tell it.
Okay.
All right, so engineer, you can take that.
Yes, I can answer that. Normally,
it's the brand. The brand was a CX. It's something CX 2305.
Yes. So this originates from the controller. The board might be okay, but the activation buttons, there's a way the user presses this button until they become very loose. So you realize the activation button is activating the movement of the board without even realizing. So the board might be okay, but now the buttons. So you need to check on the activation buttons or the control buttons.
I tried to check the control buttons. I checked the foot switch.
Yes.
They appeared fine. I don't know if I can do if there's any better maintenance I could do on them.
Because there's no way the backrest can move without activation. They have some lock mechanism. So there's a current somewhere flowing. I think you need to check again.
What can I do for those buttons?
How many control does the unit have? I told you we have three. Normally we have three controls. We have from the delivery side.
Can you see my screen?
Yes.
Can you see? I have a picture here of the board.
Okay.
If you can see, can you turn the camera? I can see.
I can't
see my camera.
No.
Can you see now? So can you turn on your camera, Chakuma? You can see. Okay. Now that's the board,
Yes.
Which is very, very fine.
Okay.
And it's housed in that. It's housed in that unit.
Yes.
When I remove the cable, one of the cables these are the cables for the motion. When I remove the movement stop.
Okay.
Unfortunately, I didn't take the picture for the button.
Yes.
This is the chair. That is the chair.
Okay.
I don't know if you can see the buttons properly, the console properly.
Yeah, I can see.
I checked things were fine. Even the foot switch was fine. I was like, hey, what's happening?
So from the
I don't know. Any special maintenance I could do, or maybe some lubricants on the switches to revive them?
No, not at all. From the control, the board you are saying it's okay. They have four contact relays there, right?
Yes, true.
So that relay, there's one. Yes, there's one which is not behaving, the one that controlling that movement. So remember they work independently. Yeah.
Yes.
So if you change the one that directly linked with the one that is controlling the backrest, the board will behave. If you have another board, try another board and see if the problem goes. So the board can be okay, but the relay are faulty. Yes.
Okay. So I can think of getting some relays.
Yes, or even just find another board to be sure you'll see that the machine is okay. It's a common problem actually.
Sometimes these machines from China, the spares are not easily found.
I know.
Yeah, so I was thinking maybe since you talked about the switches,
Yes.
the handy switches for those motions,
Yes.
maybe there could be some maintenance that I need to do, but I don't know what kind of maintenance is done. When you look at them, they appear
Yes.
to be of integrity.
Yes.
Mm.
There is a relay.
Any maintenance that can be done on them if they are loose or?
No, normally, no, they just short. The problem with them, they just short and then they pass the current.
Oh.
That is the problem. So you need to replace it.
It comes intermittently. While you are having the patient, it can just all of a sudden start moving back. Then you have to put another command to bring it back. Then it comes rest for like one for like 15 seconds, then again goes back automatically like that.
Yes, it's shorting. That is short circuiting. Okay. Yes.
Okay.
Thank you.
Is they replaceable?
Yes.
It's
replaceable. Yes. You can check the equivalent. Check the equivalent.
Okay. Thank you. The software said you can have a solution. That's why I want it. All right, so I see another hand, two hands from Good Luck and Philip. So I'll start by Good Luck. So unmute yourself and speak.
Hello, can you hear me?
Yes.
Hello, can you hear me?
Yeah, go ahead. We can hear you.
Okay, so I'm Oboro Good Luck, calling from Bayelsa NDTH Colibri Teaching Hospital. We have two dental chair in the hospital, and two of them are bad. Both of them are not moving up and down, and so I called on the dental engineers from the dental college to come and check on them, and I think they went with the board, but up to now they could not get the board, the replacement of the board, and the machine is just there. They are, I think it's constituting some health challenge to the doctors, the dentists there. So when you talk about the commissioning, can we decommission the machine since we can't get the control panel? Can we decommission the machine?
Yes, once I think that is a challenge. That is a challenge most people are facing in the market right now. That problem comes during procurement. When you're doing procurement, remember I spoke about procurement. You need to, when you procure a machine, you need to be sure that the machine you're procuring has availability of the spare parts. So now, if machine can't do its intended, it becomes very difficult. Ergonomically, there's no way you can put patient in a spine position without moving, or so it's really interfere with the patient endostructure and spine. So this machine needs to decide. Yes, sorry.
I said even the doctor too. The doctor too.
Yes, even the doctor too, because they need to take several angles to access the mouth. So this machine is unfit for use. So this is the failure of the procurement process. You need to consider that when you are doing the procurement. I think that is what I spoke about.
The machine is more than 10 to 15 years in the facility. I was employed there and I met the machine, so I don't know, maybe it's actually old. You can't lay hands on the parts again, something like that. It's an old machine, about 15 years or so.
Yeah. So that's become unfit for operation.
Okay.
We need commission, yes.
All right, so there's a question in the chat from Joseph. The chat. What are the possible oxygen therapy requirements that might arise in a dental surgery unit or sort? I'll read that.
Okay, come again. The possible oxygen therapy required that might arise in a dental surgery. In dental surgery, unless...
Right, so what are the possible oxygen therapy requirements that might arise in a dental surgery suit?
Yes. In some instances, the patient that the doctors are working on might be having some underlying issues, and probably as a result of the same, they develop breathing difficulties. So I think it's also advisable sometimes to have an oxygen outlet just for resuscitation purposes. Otherwise, in dental procedures, what we need normally is the compressor and the vacuum. Yeah, but in some cases in former cases, they were using, especially on the kids, the gaseous form to sedate the kids, because the kids are very difficult to handle during procedures. So they want to sedate them so that they become unconscious during procedures. But I understand some dental procedures happen in theaters, and all theater are clearly equipped with medical gases. And this only comes in a situation where the resuscitation is required. Otherwise, I don't think we need oxygen therapy in a normal dental procedure. Thank you.
All right, so I saw a hand from Philip, so you can unmute yourself and speak.
Mine is just a comment. Number one, an intermittent problem, particularly the movement of the head, particularly intermittent movement. Sometimes it's there, sometimes not there. Could be as a result of dry joint. So the fact that it's there sometimes and sometimes not there, which means that the components are working. So first of all, the first culprit is the dry joint, or you look at the contact of the switches. They might not be making properly. That is one. Number two, well, the lifespan of an equipment in developed countries is 10 years. And that gives you that, and you know, developed countries, these equipment are designed for developed countries. They're not designed for Africa. Africa, and the trend is very rough, and we don't adhere to the maintenance schedule of this equipment. So you find that like the dental equipment that is not as failed to move up and down was as a result of lack of maintenance. But I'm sure with proper maintenance schedule adhered to, as for the manufacturer's requirements, equipment can last longer. But for our case, it can, if we don't adhere to those ones and even our rough terrain, it will take a short time. 15 years is a long time. Even the spare parts, you will not be able to get. So if you are sharp enough, you can do modification. If you're not, then the best thing is to organize to decommission on the ground of beyond economic repair. Thank you.
Thank you, Engineer Philip.
All right, so I see a hand from Joseph Ugat. Can you unmute yourself and speak? Engineer Ugat, can you hear me?
Engineer Rogut. I called it Rogut, yeah.
All right, so I see another hand from Enoch Lutish. Can you unmute yourself and speak? All right, so there's a question in the chat from us.
Yes, do you hear me?
All right, so there's a question in the chat from Asante. All right, Enoch, can you hear me? Okay.
Yes, I can hear you.
You can ask.
Okay, I really appreciate your session. So my question is,
Enoch, we have lost you.
do you hear me?
Yes.
Okay, I'm just requesting the notes which you are using. Where would I find them? Is there a website you can share so that I can find?
All right, so you can visit us at Oxygen Alliance YouTube channel.
Oh, okay, fine. Thank you.
Sure. Yeah. So there's a question from Asante in the chat, and it reads, during the preventive maintenance, when performing the link checks how do you ensure the integrity of the tubings to prevent the leaks, and what are some of the common failure points? I'll read it again. During the preventive maintenance, when performing the link checks, how do you ensure the integrity of tubings to prevent the leaks, and what are some of the common failure points? Over to you, Engineer Joseph.
Yeah. Thank you, Asante, for the question. Well, during the leak test, I don't expect to open the whole vein of the tubes at every point. So what you need to do is you need to identify the input line, that is from the compressor, the dental unit point. That is where you'll attach your instrument. Remember, even the compressor point, we have a pressure gauge. So if the compressor continue running, should be able to know that it's a problem, because at some point you have a cut in and cut off pressures. So once the 8 bars has been achieved, the compressor will switch off automatically. So once you realize the compressor keep on running without even procedures going on, that should tell you there's a leaking point somewhere. That's one. 2, when you go to delivery point, normally the leaking point you'll start hearing by hissing. You start hearing by hissing sound. And again, you go at the point of the handpiece. The point of the handpiece, that is where you attach your attachometer. You are not supposed to open the tubing that heading towards the pressure block, unless, because remember this tubing has a constraint. They have a kind of ring that reinforces the silicone tube towards the block. So once you remove this ring, I can assure you, you need to cut the end piece. After testing, you need to cut the end piece to return back the tube back to the pressure block. But if you return it without cutting the end piece, remember, this point is already deformed. That is a clearly recipe for the future leaking. But I would suggest that you don't interfere with the internal tubings if there is no any hissing sound. Try to test the pressure from the handpiece point. Thank you.
All right.
Good afternoon, everyone.
All right, so we'll take the last question, then we'll close the session. So I see a hand from Nabil, my dean. Can you unmute yourself and speak?
Hi. Good afternoon, everyone. I have little doubt about the certificates handout for attending the meeting. Will there be any certificates handout for attending the meetings?
All right, so Nabil, the certificates are only given to those who attend our webinars more than 60%. So if you attend our webinars about 60% above, then we issue a certificate to you. I hope I've answered you.
60% means you are conducting webinars regularly weekly. We should attend more than 60% of these webinars. The duration of the webinar, we should be in the meeting for 60%.
All right, so what actually happens is our webinars are aligned by themes. So every theme has about 6 topics attached to it. For example, currently we're looking at management of medical equipment. So we have like 6 webinars, and our webinars actually happens twice every month. So out of the 6 webinars, if you calculate the percentage, if you attend at least 60% of those webinars, then you are eligible to get a certificate within that particular theme. I hope that makes sense.
Yeah, okay, fine. Thank you for your response.
All right, so this marks the end of this call. Thanks again to Engineer Joseph for excellent and education presentation. For any further questions, please don't hesitate to email us at helpdesk@oxygenalliance.org. Thank you all for attending this webinar. Until next time, it's goodbye.